assessment of nose and sinuses. Good day, ma'am. I am Llewellyn Cagingin, student nurse from APCAS. I'm here to assess your nose and sinuses. May I know what's your name and age? Okay, ma'am. I just have to start with your assessing the nose and sinuses. In order to do that, I need your cooperation. So we can know if there's any concerns or problems within your nose. And then by the time you put the results in your future checkups, so can you start now? Thank you po. Always perform for hand hygiene and provide for clients' privacy. Okay, ma'am, I just have to ask you some important questions about your history within your nose. Ma'am, magkaroon po ba kayo ng allergies? Sipuan po, hirap po sa pag-ina. Okay po, meron po ba kayo sinus infection or any injuries po sa nose? Okay, meron naman po kayong ginagamit na gamot or smell change? Okay po, okay, start na po. Inspect the external nose for any deviation in shape, size, or color and flaring or discharge from the nares. Normal findings, symmetric and straight, no discharge or flaring uniform, deviations from normal, asymmetric, discharge from nares, localized areas of redness and presence of lesions. The findings are the client has a symmetric nose and straight, no discharge or flaring, and has uniform color. Lightly palpate the external nose to determine the area of tenderness, masses, and displacement of bone and cartilage. The normal findings are no tender, no lesions, and deviations from normal is tenderness on palpation, presence of lesions. Always ask the client if the pressure of your head or fingers is too much for her or him. The findings are the nose of the client is not tender and no any presence of lesions. Determine the patency of both nasal cavities. Ask the client to close the mouth, exert pressure on one nares, and breathe through the another opposite nares. Repeat the procedure to the assess patency of the opposite nares. Normal findings are air moves freely as the client breathes through the nares, and deviations from normal is air movement is restricted in one or both nares. Observe for the presence of redness, swelling, growths, and discharge. Inspect the nasal septum between the nasal chambers. Normal findings are mucosa pink, clear, watery discharge, no lesions. Deviations from normal are mucosa red, edematous, abnormal from discharge, like pus, and presence of lesions. Normal findings are nasal septum is intact and in midline. Deviations from normal is septum deviated to the right or to the left. The findings are all good is in normal findings. Palpate the maxillary and frontal sinuses for its tenderness. It should be not tenders and the deviations from normal is tenderness in one or more sinuses.